So yeah, really excited to kind of share, what we're doing at ARTAN Bio, and then what we're doing also for VitaRNA token holders, and kind of what I've done, and why I think this is a really cool opportunity and a really cool time to build in DeSci and see how far we can take the science, and that's what I'm really, really excited about. So just to give you a bit about my background, so why am I giving this talk? And so, as Ella mentioned, I am a traditional biotech builder, PhD in cancer biology, trained in the States where I'm based, and have been building biotechs, I think, right out of grad school, actually. And so, as she mentioned, I started a company about 3 years ago in the oncology space, cancer company that ultimately was acquired by Eli Lilly for up to $300 million. And we put some of the metrics there. So, for investors, 17x on the early investors, seed investors, but it's 10x. And that was in like 1.5 years from seed to exit. And we also, had, I guess, what else do I want to say? Yeah, it was a very good deal. Okay, by all metrics, investors are very happy. They love me. And so what I'm excited to do is, again, take that ability to execute and put that into the DeSci space and assemble, we put together a really great team within ARTAN. So again, I want to share more insights there. I also co-founded a company called Recode Therapeutics that raised $450 million, and that had is some of the pharma investors, and I'll share more about kind of how I build companies. That had the venture arms of Pfizer, Sanofi, Amgen, and Bayer. And it was actually my friend, Mike Barron, who was at Pfizer Ventures, who got me into DeSci in the first place. So DeSci and crypto was not something that I had on my top of mind here. But again, I think this is a really cool opportunity, and we'll share more about it. So, awesome. Let's see. Which button? Oh, yeah. So see, that's like Kevin yesterday. We're staring at the screen, and then it's moving over here. So let's go back. Actually, okay. 2 seconds. Okay, cool. So yeah, why DeSci over traditional biotech and funding? And I think this is what's really exciting for us, is that, as you can see on the left here, traditional biotech, it's, when you invest, it's private till you have an exit or you go public, and that can take a really long time to happen. And it's cyclical. There's a lot that's, a lot of macro involved in sort of getting your money back from traditional venture backed, funding. So, and for innovators and founders, it's very dilutive. It's a very dilutive process. And so there's countless stories of these founders that have created these blockbuster drugs that never see a single cent from that. And as a scientist and drug developer and founder, that's very sad. That's very sad. And so I'm sort of trying to flip the script and better align, incentives so that the innovators can take advantage of what they've built and the transformative medicines that they've built, and be able to again have upside from there. And so fortunately for me, in my deal within Crossbridge, all of my investors did well, all of my founders did well, my scientific professors did very well. All my R&D guys did very well. They're essentially all millionaires themselves, and that's rare for biotech. And so again, the point is, that's a path that can be done through traditional biotech, and DeSci, I think, creates an even more interesting way to align these, align on the upside. So yeah, it's, and then maybe the last bullet, right? Aging is a very interesting sort of disease area, and those in the space, right, are very familiar with how we sort of think through aging as a disease. Now, thankfully, the GLP-1s and all of these, metabolic drugs have opened, I think, the eyes to folks around longevity being something that is addressable. And so I get banking reports every day from the biggest banks in the world talking about longevity as the next big, disease area that they're focusing on. And like even 3 years ago, that would not even happen. They'd be like, what the heck? This is not something that we know how to model or talk about or what have you. So again, DeSci, tokenized IP, liquid fractional ownership, on-chain milestones, very transparent, community-aligned upside through tokens and some of the other opportunities that people are working on within the DeSci space, like what we just saw from Alex. And yeah, I think you really have the opportunity to fund stuff that would not be funded through traditional VCs, and then allow that through the tokenization and other sort of incentives to be able to have upside earlier for innovators. And then we heard what Alex talked about VitaDAO, so I'll skip that just to go through a little bit further into the science. Once we kind of give you the overview of VitaRNA, which was a token that we launched about 2 years ago there. And so just to give you the view, right, we started within VitaDAO. We had an idea. I'll share more about the science in just a bit. It was about a $90,000 grant that helped do some of the early stage experiments that then funded enabled the 300K follow on, and that's when we did the tokenized IP through that. And some of you may be holders, and with that 300K, we've actually advanced the science quite a bit. And then just here recently, we had a $1 million investment into ARTAN, the company which holds the VitaRNA token, and that was like at a 4 million pre-money valuation. And so again, we're really sort of playing in this space of being able to raise on the token and then have traditional investors come in and fund the science within ARTAN. So super excited. Yeah, so again, to talk about the science, and this is actually my favorite part of what we're doing, because this is some really interesting biology that folks haven't been focused on, and so we're super excited to share more about that. And so the take home is, we all have, not to go too deep into the science, but right, amino acids, we've heard about amino acids and proteins. There are these three, they're called codons. So codons code for an amino acid that's part of a protein, and there's different codons that code for amino acids. And in the case of a specific amino acid, arginine, there's a rare codon it's a CGA codon, and C of that CGA is called cytosine, and that can be mutated very often, and that mutations are involved in like methylation, which folks have heard about for these like methylation clocks, and it also can be deaminated, and that's called like and that can make a C to T transition, and the C to T then makes the CGA to TGA, and that makes what's called a stop codon. And so as you can imagine, if you have a stop codon in your protein where it shouldn't be, then it'll stop making the protein, and then you lose that function, so you don't have that protein. And so if you look where all of these arginine mutations are found, they're found in very important proteins involved in DNA repair, so genomic stability, neuroprotection, tumor suppressors, again, very important like cellular processes. And to further highlight the importance of this CGA mutation, it's to look at the diseases in which you find these mutations. So here, what we've listed is very rare diseases in which they have an arginine mutation, and that's where this R, the numbers are the amino acid position, and then the star means it's the stop codon. So as you can see, there are many different diseases that have arginine, because again, C is very hypermutated, so it's a very like a sensitive spot in the genome, essentially, and they all have hallmarks of aging. So accelerated aging is a big part of these mutations, again, highlighting the importance of them, okay? And so, again, like this is really cool. Like this is happening real time for all of us. Like if you look at these graphs, This shows, and this is all data set, we have the publications listed here. This is showing over time the amount of CGA to TGA transitions in skin and blood, and again, very important, organs in the body. So as you can appreciate, over time, these mutations are accumulating in your skin. And in this case, this is blood without like chemo. We're showing chemo because on the next slide, I'll show you what happens with chemo. And these mutations are going up. This is happening in all of us right now. And then if you look at UV exposure, which we're all exposed to UV, it's accelerated. So again, highlighting the importance of this CGA to TGA, and then when you call back to the mutations and the protein, in which these mutations are found in, very important. And then on the right, this is data set looking at people that have been treated with chemotherapy. And as you can see with the red dots, that means that it's higher than the baseline, so you get more of these mutations over time. So again, it's really cool science, that biology, that we have developed a way to suppress these mutations, and hopefully we'll have better outcomes that way. So again, ARTAN 102 is a lead drug. This is what we initially did with the VitaRNA token, and so again, mechanism of action. So one mechanism, multiple aging diseases. So the CGA to TGA we talked about. Again, very important proteins and tumor suppressors. Obviously, if you lose tumor suppressors, you increase your cancer risk. And ARTAN 102 can fix this. And so we're super excited to be building within the DeSci space. So here's some data talking about what we're working on. And so in this case, we're using a virus to deliver a reporter. So this is with this GFP. So you can see when we add our virus, not carrying our active drug, you can see the cells light up green. That means that it gets into the cells. And then over here on the right, this is looking at protein. And so if you see what's called like lane 2, and essentially you don't see anything, and then and lane 6, which is obviously the one that is very prominent, you see rescue of the protein, which is called P53, which is a very important tumor suppressor. And so our drug is essentially rescuing and putting back that protein, and then hopefully having a positive effect on what these proteins normally would be doing, suppressing tumors, repairing your DNA, so forth and so on. And so right now we are, continuing to scale this up so that we make enough of the material to do, further animal studies. In the meantime, we did do a study in mice where we looked at where the tRNA was found in what tissues using a viral vector called AAV9. It's the AAV, which has been used in commercial products, or there are drugs on the market that use AAV9. So here, if you're looking in mice with a pretty modest dose, this is not a high dose of virus, which is listed here. This was 14 days past the dose. You see, over a 4x increase in brain, in heart. Obviously, the numbers are different, but as you can see, right, brain, heart, liver, lung, pancreas, the kidney, these are all cells in which we were able, or tissues in which we were able to detect our tRNA. So you can imagine this is happening all over your body. If we could deliver this in as many tissues as possible, we could be suppressing these age-related mutations. And this is a nice data set in mice. And in the case of AAV, mice and monkey correlate really well with humans. So there's a really nice path to moving this drug forward. Aging, you always have to have a slide on, it's a big market, and I think GLP-1 class has been able to show that. And so, we're trying to think through how do we look at indications. And so one way, again, as we talked about, is going after post-chemo aging, but there's other opportunities with the drug that we're making. But point is, big markets, huge unmet need, and could be really cool way to go forward. And to kind of walk through the drug development path, as I mentioned, right, typically you need to scale up your drug, do that through what's called GMP manufacturing, and then you do your tox studies in typically non-human primates. You file that with regulators, and that could be in the US, EU, In this case, we've chatted with folks in the UAE. I think that's an interesting place to do these studies. China is also, continues to be an area where you can do very quick and simple studies within the hospital system within China and get data really fast, very cheap. But you have to have those relationships in China. And I'm speaking at a conference that WuXi, which is the biggest like CRO, CDMO, everything in China. I'm a speaker in September, so they're hosting me in Shanghai. So again, just building on these relationships. So I'm always thinking of how to create value very capital efficiently, which is also part of like the Crossbridge story as well. So again, working through all of these things, but the key step for us with ARTAN 102 is the manufacturing. So we're currently working on that right now with various folks. But besides ARTAN 102, again, just thinking very broadly on how do we create value for us and stakeholders, we're working with a company called Cyanex that has this really cool delivery vehicles that in this case, we're looking to hit HSCs, which are hematopoietic stem cells, so blood stem cells essentially, and that's also a big area where these mutations occur. And so we've already started this work again with Cyanex to go after a disease called CHIP, which is clonal hematopoiesis of indeterminate potential is what it's called. And we all have CHIP mutations actually, again, just like I was saying, particularly in this arginine mutations. And so we're working on that. We actually have a really cool skin product that we're working on, and we have a slide on that. And so again, it's all centered around this biology, which is really cool, and we're being very creative in terms of the products and the drugs that we make with it. Okay, so this is actually, Vita Beauty, and so the premise behind this is, again, with ARTAN 102, we're actually delivering or expressing a specific type of RNA that will correct these mutations. And so in this case, you can make this RNA like mRNA or siRNA, and then you could package it in a nanoparticle. And in our case, what we thought was really interesting is if we could take lipids that are used in cosmetic products like vitamin E and chitosan and hyaluronic acid and build a nanoparticle with these cosmetic-friendly lipids, and then put this tRNA in where we know we can correct these mutations, and then deliver it in a product like this, which is a microneedle device, which is a way to get into the skin cells. that this could be a really interesting product that we could launch very fast. And so we've actually already started this. So we're screening the lipids right now to make the nanoparticle and working with CROs to build this cosmetic formulation. And hopefully by the end of the year, we'll have like an MVP that then we could consider taking pre-orders and start working. So we've already, again, have the tRNA that works. We validated it. We have a few key lipids that can bind the tRNA. That's very important. And then you sort of need the rest of what's called like helper lipids to make your nanoparticle, make sure it's stable, make sure you can still get in cells, but the microneedle device helps do that. So it's a very clean path to a product, and that leverages the cool science that we're building or that we're leveraging within ARTAN. Cool. And so again, I think Ben talked about this earlier, but we're always thinking through how to align with stakeholders. And so in this case, right, we have ARTAN Bio, it's a C Corp. We had ARTAN Holdings. This is what hold the IP that did the IP NFT. And then there's the VitaRNA token that is correlated with basically everything that we're doing within ARTAN, and we're continuing to figure out ways to add more incentives for stakeholders to participate in what we're doing. And so again, you heard with Ben to the company to coin model, so we're talking through that. We also have a sponsored research agreement that can potentially have some upside to the holdco that holds the IP NFT. So again, this is done MiCA compliantly and all the regulatory ways, all the regulatory things that you need to. So again, I think that the top the top line is what I have in green. You know, we're creating multiple ways for token holders to win, and investors as well. This is, you know, a very important part in how you build biotech. You know, investors want returns, and so, you know, and I'm sure token holders do as well. So we're figuring out ways to do that the right way so that we're, you know, can create a path that others can go through and optimize even further. And so last couple of slides, just want to highlight some of the team. Two of my guys are here as well. So Anthony Schwartz is here, Brian is here, all biotech experts, and then myself, and then we have a really cool guy as a physician named Tim Taxter who works for Tempus. He's a pathologist, you know, also a chip expert. So again, it's all about leveraging, you know, the know-how of folks align on a cool vision and get to work. And we're really excited about where we're going to take ARTAN. So maybe with that, I don't even know how fast or slow I went, but I think, you know, thank you guys for giving me some time. So.
Thank you so much, Michael.